Good morning, everybody. There we go. I just wanted to say welcome, and I hope everybody had some coffee this morning. I am Faith Lynch. I am the current national president of ANNA. There's my picture, just in case you guys don't know who I am. So a little bit about me. So I currently am the senior director of dialysis at NYU, and then my other job right now is obviously the president of ANNA. I just want to say that we are Prabir and I are so excited that everybody is here we're doing something different today, something that we haven't done with ANNA and ASN, which is the American Society of Nephrology, for those of you who do not know, as a collaborative event for physicians and nurses to be together, be educated on the important things that we do together every day. I mean, we work so closely in this discipline, and I think it's really important that we're all together and collaborating and discussing issues that we face every single day. So Prabir, I'm going to hand it over to you to give a few words, and you can introduce yourself as well. Look, there's your picture. And here is Dr. Prabir Choudhury from ASN. He's the president.
All right. I'll give that to you. Great. Well, thank you all so much. And yes, I think that's a younger picture of me. So that's I have no complaints. I did want to say a few words. So by way of introduction, my name's Prabir Roy-Chaudhury. I am a transplant nephrologist at the University of North Carolina at Chapel Hill, and also at the Salisbury VA, which is just 40 miles from here. And I'm also the current ASN president. And I want to start off by saying that on behalf of ASN, it is a distinct privilege and honor to welcome all of you to this first day of collaboration between the American Society of Nephrology and ANNA. And I was going to tell Faith, I have about 5 minutes of presentation, so you're welcome to sit down. I'm going to be a bit longer because this is a really, really important meeting. But before I make my comments, I particularly want to thank my co-chair and your president, Faith Lynch. Faith has truly been the driving force behind this meeting, and so let's give her a round of applause. I want to start off at this point by saying that I think this is an incredibly exciting time for kidney care, and particularly for the younger APPs and nurses and physicians in the audience. I really want to say this loud and clear. There has never been a better time to be involved in kidney care. And I say this because for the first time in 25 years, we have a whole set of new therapies that actually span the entire continuum from upstream glomerulonephritidis to cardiokidney metabolic disease to innovative ways of kidney replacement therapy, all the way to xenotransplantation. And we're going to have Dr. Montgomery, who's really the world expert on this, speak to you. But what's important is that it's not just the new therapies. There are new process of care pathways that we're all talking about. There are new payment pathways that I believe for the first time ever are actually aligned with value. And so our challenge at this point in time, the challenge for all of us really, is we have to grasp this opportunity in time. We have to grab this inflection point in kidney care and make sure that we do not have another 25 years of therapeutic stagnation, which really has been the majority of my career. And I very strongly believe that the way that we can do this is through the implementation of these new therapies to all the patients who could benefit from them, particularly the most vulnerable. And if we want to be serious about implementation, the only way that we can do that is by bringing together all the stakeholders in kidney care together. And there are lots of stakeholders. So there are industry partners, there are federal agencies, there are LDOs, there are healthcare systems, there are payers. But the point that I want to make, and this is why this meeting is so important, is that the core group that is always going to be responsible for implementing change in kidney care in the right way for our patients, it's going to be nurses, APPs, and physicians. And that's the reason why this day of collaboration, to me, Faith, is so important. And so as you go through this day, please, this is the most important part of this day, interact with each other, talk to each other, question each other, exchange ideas, clearly challenge each other. But most importantly, when you go back to your practices, right, when you go back to your places of work, please do try and implement at least one thing that you learn from this meeting that you can do collaboratively together. Because true change, and to me this is very important, true change in kidney care will only occur if all of you, all of us, are a part of the change. So I just want to say thank you, Faith and ANNA, for inviting ASN, and I want to thank all the ASN participants and all the ANA participants. I think that this is truly a unique and I would say incredibly timely summit, an incredibly timely day of collaboration, and I really hope that this will be the first of many. So over to you.